1,385 people with COVID are hospitalized here in St. Louis. That is a pandemic record.
And that's why, along with worker shortages, area hospitals are asking the White House to send in doctors and nurses. News 4's Russell Kinsall is at Mercy and Creve Coeur learning more about the request for help. Russell?
Well, 4 of the 11 hospitals asking for federal help are Mercy hospitals. I'm told the earliest that any doctors or nurses sent by the federal government could be here in the St. Louis area will be January 28th. Hospitals say they're being as resourceful as they can with their personnel, but still, they don't have enough.
I feel that I'm able to really make a difference.
Justin Bolin is making a difference at Mercy Hospital. He's a registered nurse, but in recent years has been working for the Mercy Health System in an office on quality and safety. Because of staffing shortages, Mercy has asked employees not in patient care to pitch in. So he did.
I'll transport patients out to their ride if they're getting discharged, feed patients. I've given some insulin.
Bolin's been working as a runner, doing whatever's needed to free up nurses to spend more time caring for patients.
I can actually go to another room and help that patient there while Justin feeds my other patient. It has helped out tremendously today.
Despite the help from fellow employees, hospitals are struggling with a shortage of people to care for patients. Dr. Alex Garza is co-leader of the St. Louis Pandemic Task Force.
And that's due to people being either out sick, on quarantine, taking care of loved ones, taking care of children whose schools have closed. All of those things are really complicating our ability to take care of all of these patients.
If the requests are approved, the feds could send doctors, nurses, and other medical staff from the Department of Defense, the Department of Health and Human Services, the Veterans Administration, or the U.S. Public Health Commission Corps. Some would come for 2 weeks, others for 30 days. The federal government has set teams that they can deploy after hurricanes or during a pandemic.
And so even though you may ask for, 100 people, if their team consists of 20 people, then that's what you're going to get.
And even if the number of COVID cases starts to drop significantly, Garza says the extra help will still be needed.
But hospitalizations don't follow that same trend. It takes a long time for those patients to get well enough to go home.
Before hospitals find out how much help they're going to get, they have to get the initial approval to their requests. I'm told that should be coming very soon. Live in Creve Coeur, Russell Kinsall, News 4.